Before now, the only thing that I have heard about anything freezing is I heard of frozen fish, frozen chicken, and maybe food we put inside freezer. But have you heard about frozen pelvis? Frozen pelvis. Women are going through a lot too. You might not understand. Now there's something that we call frozen pelvis. This image you're seeing here is a typical description of frozen pelvis. Normally, a woman, her organs in her pelvis are free. They kind of have a way, they're structured in a way that they can move freely in relative to one another. Okay, so they are not matted together, they can slide over one another. As you can see in this image, the normal pelvis, you see how relatively structured these organs are. But if you look at this other one, it is frozen. So what is frozen pelvis? This is when the organs in the pelvis are now joined or stuck together as a result of severe adhesions. Yes, adhesions have a way of sticking organs together. So when these organs are stuck together, matted together, just like this, you can see that they are in a way that they can no longer move. They are not joined together. So the pelvis is now in an immobile um, atmosphere where it can no longer, the organs can no longer move in relative to another. And this is very common with people with endometriosis. Yes, because endometriosis most times is known for adhesions, as it's causing inflammation, as the inflamed area is healing by scarring. And because of that, most of the organs are healing by scarring, and then they are matting together, and the end of it is this particular frozen pelvis. And now frozen pelvis can be caused by, the number one is the endometriosis. Two, even pelvic inflammatory disease can cause frozen pelvis. Then advanced cases of some gynecological cancer like ovarian cancer can actually cause frozen pelvis. Now the thing is about this frozen pelvis is that most times it's very difficult with people with frozen pelvis to, like, fertility becomes challenging for people with frozen pelvis, because these organs are no longer having enough blood supply, they are no longer mobile relative to each other. And so especially when the ovaries, the bowels, the pouch of Douglas, like every structure in the pelvis is now frozen together, it becomes a problem. And even when you want to go for surgery, you know what I mean, carefully separating these organs, as you can see, can become